Welcome back to Hidden Health Facts, the channel that uncovers the dangers hiding right under your nose, literally. Today we're talking about something so common that an estimated 1 billion people on this planet live with it, and most of them don't even know it. It's called sleep apnea, and despite the name sounding harmless, almost like a minor sleep inconvenience, it is anything but harmless. By the end of this video, you're going to understand exactly how this condition silently damages your heart, your brain, and your body, night after night, year after year. And more importantly, you're going to learn the warning signs that most doctors miss, and the steps you can take starting tonight to protect yourself or someone you love. Because here's the unsettling truth. The person snoring loudly next to you might not just be annoying you. They might be suffocating in slow motion every few minutes, all night long. Let's start by breaking down what sleep apnea actually is, because the word itself trips people up. Apnea comes from the Greek word meaning without breath. There are three main types, and understanding the difference matters. The most common is obstructive sleep apnea, where the physical airway collapses and blocks airflow. The second type is central sleep apnea, which is actually a neurological problem. In this case, the airway is fine, but the brain simply fails to send the correct signals to the breathing muscles. It literally forgets to tell your body to breathe. The third type is called complex or mixed sleep apnea, which is a combination of both. Most of what we'll cover today applies primarily to obstructive sleep apnea, since it accounts for the vast majority of cases. But it's worth knowing that this condition isn't always just a physical plumbing problem. Sometimes it goes right to the source, your brain's own control system. Now let's talk about what's actually happening inside the body during a sleep apnea episode. When you fall asleep, the muscles in your throat naturally relax. For most people, this is completely fine. The airway stays open, air moves freely, and sleep does its job. But for someone with obstructive sleep apnea, those relaxed muscles collapse just enough to block the airway entirely. Air simply stops moving. Your brain doesn't know why oxygen levels are dropping. It only knows that they are, so it triggers a mini panic response, jolting you just enough to reopen the airway. Not enough to fully wake you, but enough to completely shatter the deep, restorative sleep your body desperately needs. This can happen 5 times an hour. It can happen 30 times an hour. In severe cases, it happens over 60 times every single hour, all night, every night. To put that in perspective, if you have severe sleep apnea and you sleep for 7 hours, your body could be disrupted over 400 times in a single night. 400 oxygen crashes, 400 emergency stress responses, 400 tiny moments where your brain lurches out of deep sleep to save your life, while you lie there completely unaware, dreaming, or at least trying to. Now here's what most people don't know. Each one of these pauses causes your blood oxygen level to drop, sometimes dramatically. A healthy person sleeping peacefully maintains blood oxygen saturation above 95%. During a severe apnea episode, that number can plunge below 80%. To give you a reference point, hospitals typically intervene with supplemental oxygen when levels drop below 90. People with untreated sleep apnea hit numbers like that dozens of times a night and go right back to sleep without ever knowing it happened. Your heart, sensing the drop, has to work harder to compensate. Your blood pressure spikes. Your nervous system goes into a low-grade state of stress, over and over, hundreds of times a night. Do that for years, and the damage adds up in ways that are genuinely frightening. Studies have linked untreated sleep apnea to a significantly higher risk of high blood pressure, irregular heart rhythms, heart attacks, and stroke. Some research suggests people with severe, untreated sleep apnea face nearly double the risk of dying from cardiovascular disease compared to those without it. One of the most dangerous rhythm disorders it's connected to is atrial fibrillation, commonly known as AFib, a condition where the upper chambers of the heart beat chaotically and out of sync. AFib dramatically increases stroke risk, and research consistently shows that people with sleep apnea have much higher rates of it. In fact, some cardiologists now routinely screen heart patients for sleep apnea, because the connection is that well established. And it's not just the heart. The brain takes a serious beating too. Chronic oxygen deprivation during sleep has been associated with memory problems, difficulty concentrating, slowed reaction time, and even an increased risk of cognitive decline later in life. Some researchers believe there's a meaningful connection between long-term untreated sleep, apnea, and a higher risk of conditions like dementia and Alzheimer's disease. The theory is that during deep sleep, the brain runs a kind of waste clearance system, flushing out toxic proteins that accumulate throughout the day. When sleep apnea constantly disrupts deep sleep, that cleaning process can't do its job properly. Over years and decades, those proteins build up, and we already know what happens when they do. There's also a hormonal dimension to this that doesn't get nearly enough attention. Growth hormone, which in adults plays a critical role in tissue repair, metabolism, and immune function, is primarily released during the deepest stages of sleep. When sleep apnea fragments that deep sleep, night after night, growth hormone secretion drops significantly. The result can be slower physical recovery, a weakened immune system, weight gain that's harder to shift, and a general sense of physical deterioration that's genuinely hard to pin down. And then there's cortisol. Every time the brain sounds the alarm to reopen the airway, a small dose of cortisol, your primary stress hormone, gets released. Multiply that by hundreds of episodes a night, and you have a body that is essentially marinating in chronic low-level stress hormones around the clock. That pattern is directly connected to insulin resistance, type 2 diabetes, weight gain around the midsection, and long-term metabolic dysfunction. Sleep apnea doesn't just make you tired, it quietly rewires your body's chemistry while you sleep. Here's the part that catches almost everyone off guard. You don't have to be overweight to have sleep apnea. Yes, excess weight around the neck is a major risk factor, but thin people, fit people, even elite athletes can have it too, often because of jaw structure, a small or recessed chin, nasal blockages, enlarged tonsils, or simply how their airway is shaped. Men are statistically more likely to develop it than women, but that gap narrows significantly after menopause, suggesting that hormones play a protective role that disappears with age. Children can have sleep apnea too, often caused by enlarged tonsils or adenoids, and in kids, the signs can look completely different from what you'd expect in adults. Instead of excessive sleepiness, children with sleep apnea may be hyperactive, inattentive, and frequently misdiagnosed with ADHD. It's estimated that a meaningful percentage of children diagnosed with attention disorders may actually have undiagnosed sleep apnea driving their symptoms. That's a staggering thought. And here's another myth worth busting. Snoring and sleep apnea are not the same thing. Plenty of people snore without any dangerous pauses in breathing. Snoring is the sound of a partially restricted airway. Sleep apnea is what happens when that restriction goes all the way to a full blockage. But loud, chronic snoring combined with gasping, choking sounds, or witnessed pauses in breathing, that combination is a major red flag that should never be dismissed as just heavy sleeping. The scariest part of all of this is that the person experiencing it almost never knows. They don't remember the gasping. They don't remember waking up dozens of times. All they know is that no matter how many hours they sleep, they wake up exhausted. They might have a headache in the morning, a dry mouth, a foggy mind that takes hours to clear. And because it's been going on so long, they just assume that's how life is now. That's their normal. It isn't. Let's talk about the population that is most at risk, because the numbers are genuinely alarming. It's estimated that about 80 to 90% of people with moderate to severe sleep apnea are completely undiagnosed. Think about that. The vast majority of people suffering the nightly cardiovascular and neurological consequences of this condition have never been tested, never been told, and have no idea. Part of the reason is cultural. Snoring is often treated as a punchline, a quirky bedroom habit, something to joke about rather than investigate. Partners get elbowed, people get teased, and the conversation never makes it to a doctor's office. Another reason is that many of the symptoms, fatigue, moodiness, trouble concentrating, are so generic that they get attributed to stress, aging, or just the demands of modern life. And primary care physicians, who are incredibly overworked and managing dozens of conditions per patient, don't always have the time or training to probe deeply into sleep quality during a routine checkup. But here's the good news, and it is genuinely empowering. Sleep apnea is one of the most treatable serious health conditions out there, once it's identified. The first step is recognition. If you or someone close to you has loud, chronic snoring, gasping, or choking sounds during sleep, morning headaches, dry mouth on waking, or daytime exhaustion despite a full night in bed, those are signals worth taking seriously. Not ignoring, not explaining away, and not just tolerating for another year. The gold standard for diagnosis is a sleep study, which sounds intimidating but has become remarkably accessible, while full in-lab polysomnography, which monitors brain waves, muscle activity, eye movements, oxygen levels, heart rate, and breathing simultaneously, is still the most comprehensive option. Home sleep tests have become widely used for straightforward cases. These are small, simple devices you take home, strap on at night, and return the next morning. They measure oxygen levels, breathing effort, and heart rate while you sleep in your own bed. Results are analyzed by a specialist, and for many people, that's all it takes to get a clear diagnosis. No hospital stay, no wires attached to your scalp, just one night at home, and answers that could change the course of your health. If diagnosed, the most common and effective treatment is something called CPAP therapy. CPAP stands for Continuous Positive Airway Pressure. It's a small machine that sits on your nightstand, generates a gentle, steady stream of air, and delivers it through a mask you wear over your nose or mouth while you sleep. That constant pressure acts as a kind of pneumatic splint, holding the airway open so it can never collapse. It sounds intimidating at first, and there's no point pretending the adjustment period is always easy. Some people adapt in days. Others take a few weeks. But the vast majority of people who commit to using it describe the change as life-altering. Real energy, actual mental clarity, the ability to wake up in the morning and feel genuinely rested, possibly for the first time in years. Sometimes that shift happens within just a few nights of consistent use. Modern CPAP machines are also significantly more sophisticated than they used to be. Many now automatically adjust pressure throughout the night based on real-time breathing patterns, making them more comfortable and more effective. The masks have improved dramatically too. Lighter, softer, less obtrusive, with options for people who breathe through their mouth, people who can't tolerate anything over their nose, and people who sleep in all kinds of positions. The technology has genuinely evolved, and many of the old complaints about CPAP, that it's loud, uncomfortable, or claustrophobic, are far less common with modern equipment. For people who genuinely struggle with CPAP, and there are some, there are other proven options worth knowing about. Oral appliances, custom-fitted devices made by a dentist trained in sleep medicine, reposition the jaw slightly forward during sleep to help keep the airway open. They're particularly effective for mild to moderate cases, and for people whose anatomy makes them a better candidate than CPAP. Positional therapy is another option for people whose apnea is significantly worse when sleeping on their back. Special devices, ranging from simple foam wedges to smart wearable sensors, help train the body to stay on its side throughout the night. For some people, this alone dramatically reduces the number of events per hour. In select cases, surgical interventions can address specific structural causes: enlarged tonsils, a deviated septum, a narrow jaw. There are also newer implantable devices, known as upper airway stimulation therapy, that deliver gentle electrical impulses to the nerve controlling the tongue muscle, preventing it from collapsing backward during sleep. These have shown genuinely impressive results for patients who haven't responded to other treatments. And lifestyle changes, while they're not a cure on their own, can meaningfully reduce the severity of symptoms for many people. Reducing alcohol consumption in the hours before bed is particularly important, because alcohol is a muscle relaxant that makes airway collapse significantly more likely. Sleeping on your side instead of your back, treating nasal congestion, avoiding sedating medications unless medically necessary, and maintaining a healthy weight can all help reduce the frequency and severity of apnea events. These aren't replacements for treatment, but they're powerful supplements to it. The most important thing to understand is this: you are not stuck with this. Sleep apnea is not a life sentence of exhaustion, hidden cardiovascular damage, and quietly dimming brain function. It is a manageable, treatable condition, but only if it's identified and addressed. The people who never find out, who spend a decade or two silently accumulating heart damage and brain stress, aren't weaker or less lucky. They just never got the information they needed. That's exactly what this channel exists to change. So let's bring this all together. Sleep apnea is not just snoring. It's not just feeling a little tired. It is a repeated, nightly assault on your oxygen levels, your heart, and your brain, happening silently, while you're completely unaware. It raises your blood pressure, stresses your cardiovascular system, disrupts the hormones your body depends on, fragments the deep sleep that cleans and repairs your brain and leaves you running on empty day after day, while the damage quietly accumulates underneath. But unlike so many hidden health threats, this one comes with clear warning signs, a straightforward path to diagnosis, and genuinely effective treatment options that have transformed millions of lives. The only thing standing between living with hidden damage and living with real, restored energy is recognizing the signs and taking that first step. If this video opened your eyes to something you didn't fully understand before, do me a favor, hit that like button. It genuinely helps this information reach more people who need to hear it. Subscribe to Hidden Health Facts so you never miss the hidden dangers we uncover every week. And if you, or someone you love, snores loudly or wakes up exhausted no matter how much they sleep, drop a comment below and tell us. You might just help someone else recognize the signs in themselves.